miss The Devil Wears Prada 2 in cinemas.
Miranda, hi.
Pull yourself together. We have work to do. And by we, I mean you.
Meryl Streep, Anne Hathaway, Emily Blunt, and Stanley Tucci are back.
Oh-de-da.
On April 30.
Look what TJ Maxx dragged in.
I am the new features editor at Runway.
No, you are not.
Icons reign forever.
Cheers. Wait. I hope to God that's not what you're wearing to the dinner. That's all.
Get tickets now. The Devil Wears Prada 2. Only in cinemas April 30. Directed by David Frankel.
This podcast is brought to you by Australia's LGBTQIA+ community media organisation, Joy.
We acknowledge the traditional owners of the land, the Boonwurrung people of the Kulin Nation. We pay our respects to their elders past, present and emerging, and Aboriginal people who are listening. We acknowledge that sovereignty was never ceded.
Welcome to Still Here, Still Queer, the show that celebrates the fierce, funny and fabulous lives of our rainbow elders. Each week we share stories, music and conversations that honour our rich history, challenge ageism and spark connection across generations. Whether you're a proud elder, a curious ally or just here for the glitter and wisdom, welcome. We're still here, still queer, and we're not going anywhere.
Too right. We have just got here. We're still here, still queer. And you did. We'll hope to do the same. Pete, what have we got on today?
Well, tonight's show is all about caring for ourselves as we age, our bodies, our health, and how we navigate systems that haven't always been designed with our communities in mind. Because
that is deep. Let's hope we can cover all that in an hour.
Of course we can. We've got two amazing guests here.
You do.
Because getting older isn't about slowing down or fading out. It's about learning new ways to stay strong, informed and connected. Joining me tonight are two incredible guests, bringing you both personal care and a professional insight to the conversation. First, it's Molly Lowther. Hello, Molly.
Hello.
Fantastic. Molly is an exercise physiologist working in private practice and with the Australian Prostate Centre. Yes, who helps people use movement as medicine, especially when navigating chronic conditions like cancer. True?
Very true.
Fantastic. We've also got Mick Cromer, who is a urology nurse at the Australian Prostate Centre.
I feel that there is a theme here. Isn't there?
There is.
About prostate and urology.
There is.
Right.
Most people have got one, you haven't.
No. Fair enough. Carry on.
Men have got them and trans women have got them as well, of course.
There you go.
And you've been an important part of a project entitled, now this really is a tongue twister, so it must be an academic thing, was it?
In a sense.
So maybe we should let Mick say the project. Is it going to be easy for you to say it?
Probing the prostate.
Oh, we'll just leave it at that, I think.
I love it.
It is co-funded by the Australian Prostate Centre, Movember and Thornton Harbour Health.
Great.
Up in this building. So together tonight, we'll explore how we care for our bodies as we age, how exercise can support us through illness and recovery, and how healthcare systems are evolving to better include and support LGBTQIA+ people. And as always, we'd love to hear from you out there. We've got the text line and the email lines open. Where do they send them?
Well, you go to, if you're on the text line, it is 0427 569 949 if you want to send us an email on air at joy.org.au.
Exactly. Now, who will we start with, do you think?
Let's start in the order that you started. Let's talk to the physiologist, the exercise physiologist, Molly.
Molly, yes. Hello, Molly.
Hello, Peter.
You're also my exercise physiology because I go to the prostate centre. I happen to have prostate cancer, or have had for 5 years. What is an exercise physiologist?
Yeah. Great question.
We've heard a lot from personal trainers and people like that. What's the difference?
The difference is, in short, a lot of university. So big HECS fees that we have to pay. No, we use exercise as a mode of rehabilitation and treatment to help anyone who is needing exercise for cancer, for other chronic conditions, whereas PTs generally work with healthy populations. So we just have a bit more specialty knowledge in those areas.
Yep. And how are you different from physios?
Yes.
Because a lot of people ask
Another
that
good question.
too.
Bit of grey area between the crossover of allied health, but physios I'd say with more hands-on manual approach They do massage and they do exercise, but they don't specialise in that area. So we specialise in all exercise for every treatment and every condition.
Okay. Julian, have you got any questions?
I have so many. Because we're talking, as well as your private practice, you work at the prostate centre.
Yep.
What the hell do you need to do to help a prostate cancer patient recover? Is there something specific?
Yes, with the exercise, absolutely, for side effects of treatment.
Ah.
So the hormone therapy in particular, which Peter knows quite a bit about as well.
I'll admit to being on that. And the hot flushes are terrible.
Yes, so it creates a loss of muscle mass and bone density. So exercise is actually the safest and best way to counteract those side effects. So better than other medication in that respect. And we have a lot of fun in the gym.
We do.
I hope.
That is another important question because I do a bit of personal training, not as in, oh my goodness, I'm not the one conducting it. I'm the patient in that, and I'm not having fun.
Oh, we have a lot of fun.
Do you?
Yeah. It's called the torture room sometimes, but only during assessment. The rest
Only
of the time,
when Molly's in there, it's called the torture room.
I come in and out, it's fine. No, a lot of fun. We create a group social support kind of network and have social connections and have music and have dogs in there. So we have as many dogs as we
sounding
can.
all right.
And everyone gets along very well, particularly in a couple of Peter's groups. They are very good blokes in there.
Yeah, and we've got a couple of people in their late 80s and
Mid-90s.
one in the 90s,
Yeah.
mid-90s
Wow.
coming in. Yeah,
It's a shame that I'm never going to be able to join this group. I think...
get prostate and you will.
Sure, why not? Maybe I can just, what's the word? Identify.
Oh, you could.
You've got fans already, both of you. Somebody says, I'm biased. I've been very satisfied and impressed queer patient of one of Mick's colleagues at the APC. So this is one of your nurse colleagues, I take it. I also regularly attend one of Molly's exercise classes, and I can't underline enough the exceptional help her advice and program setting has been on my prostate journey. I'm so grateful to have Molly on my side. She is inspirational. You're not even blushing. I would be. Also, staff at the APC are amazing queer allies. Now we're getting the sound effects. Congrats and hugs, the Coit champion.
Oh, I know who that is, and I'm still going to put his weights up next week.
I like it.
Very high. Still here, still queer. We'll tell you what to do.
Still here, we are still queer, and we are still talking about Iodi prostate.
Yes, the old prostate, which I don't have any anymore.
So when you have prostate cancer, they remove it.
Not in all cases.
I see.
50%. Is that right, Mick?
Sometimes it's contextual.
It's unique. The path
Each
you go through
person,
is unique.
each person is unique. Yeah.
I've got you.
That's right.
All right.
Now, a urology nurse. I'm curious about what your day looks like.
So I do the nursing for all of the uro-oncology streams. So that's bladder cancer, kidney cancer, prostate cancer, as well as some sort of functional urology, people who are going to the toilet too often and things like that. But the bulk of my work is in prostate cancer at the Australian Prostate Centre.
Okay. Fantastic. That's what a day looks like for you.
Working with different patients, who come through, and we chat to them about their side effects, a lot of supportive care needs, informational signposting, things like that.
And we had a question for you already, I think.
We did.
Read it out, Molly. This one here.
Yes. Yep. Question for Mick. What advice would you give your younger self in terms of prostate health?
This is from a 26-year-old.
As a 26-year-old, I don't think there's a great deal that you need to do in terms of your prostate health. It's not something that you can modify greatly, but it's good to know that it's something that you need to keep an eye on. I think at 26, all you need to know is if there's a family history of prostate problems, uncles, grandparents, your father, for example. You don't need to do any monitoring at all until you're 40 if your family has prostate problems, or 50 if they don't. So at 26, I would say live your life. Don't worry about it.
Terrific.
Fantastic.
And what do you need to look out for? Say if you've got no history and you haven't tested for it, but you're thinking, is it EOD going to the toilet a lot?
Typically, yes, it is. Yeah, going to the toilet a lot, getting up at night to go to the toilet.
I'm so glad I don't have a prostate, because I tell you what, like, as soon as I get comfy in bed, that's it. Oh, I've got to go.
Yeah. So getting up at night to go to the toilet, that's a big symptom. Certainly, any kind of bothersome urinary symptoms, yeah.
Because it's not necessarily a painful condition, is it?
No, and in many cases, there are no symptoms at all. So certainly, that's often a trigger for people to do a prostate check, which is a blood test these days. But outside of that, sometimes you don't have any symptoms at all. So it's really important that people know that to do their screening after they turn 50 to monitor their prostate, basically.
Which is merely a blood test these days. People used to be afraid of the old test, which was doctors using their finger to feel for it. But now it's just a blood test.
Exactly. Not as uncomfortable as it used to be.
No, that's right.
Not as invasive.
Yes.
So you're a nurse practitioner, which I love, that this has become more the way. So it's not just, you don't always have to see a doctor for every part of the process. How much can you do as a nurse practitioner?
I do a great deal of work in management. So once patients have been diagnosed and they've got ongoing care plans, so people are having treatment for prostate cancer, basically hormone treatment, any kind of medication, they need to have intermittent monitoring with blood tests or imaging. So nurse practitioners working in prostate cancer can order those medications, they can order imaging, they can monitor those things without the need for them to, I guess, defer to the medical team. So it saves time and helps us prioritize care. For more complex cases, can go and see the urologist. The other cases will come to us and see us in the nurse prac clinic.
And we can get right down into it. Because I know I used, not you, but another nurse there, about sexual function, because it gets disrupted quite badly in some people and they need advice on it and how it can work.
Absolutely, yeah. We spend a lot of time talking about penises. It's a huge amount of the day. So it's a sensitive topic, but we do spend a lot of time doing that. And it's a thing that really disrupts people's lives, and they sometimes feel like they don't have enough information about this stuff, but there's treatment available, and we nurses spend a great deal of time talking to people about how to manage that and how to move on with their sex lives.
Yeah, they've got some great little models, the nurses, and they bring them out and show how this fits in there, and it's really quite impressive.
Wow, in between the gym and the models, it sounds like going back to school. Now, somebody, Mick, I presume they know you, because we've had 2 messages saying...
Oh, another one.
I want to know, do you just have a face for radio?
Yeah, so I'll give a shout out to my buddies in West Brunswick who are probably sitting around listening to this program now. You can't get anywhere without your community.
Great. I tell you what, he doesn't have a face for radio. It's very attractive, the pair of you.
Yeah,
Can I say that? We're probably not allowed to talk about that, but that's what I'm saying.
And if you want, they're clapping. They're doing a high five there.
We have another question here. Dear loves, I'm a 53-year-old male. My older brother had prostate cancer last year. What can I be doing to check on myself, please? I believe I've already done a blood test through my GP.
In this case, so if you have a family member who has already had a diagnosis of prostate cancer and you're over 50, then you do your PSA blood test each year, and the threshold is slightly different. So instead of a level above 3 being a Q to investigate further, a PSA level of 2, in fact, is the threshold to investigate further. So I think you talk to your GP and check that test has been done, because I think that in a lot of cases now the GPs won't check the PSA just as part of your regular screen.
Oh, okay. That's great advice. Somebody else is saying, can you check your own prostate for any signs?
You certainly can check. I don't think that you'd be able to make a diagnosis, but it certainly, if you want to have a rifle around down there, you go for it.
Because somebody else did say, and I thought they were joking, how do I find my urethra? Maybe they were being serious. Can you give us potted guidance?
In this case, I think the only thing you could possibly do is to see a nurse and get them to show you.
I think that's very good advice. Now, Bartley has named themselves.
Oh.
Says, thank you so much, Molly and Mick, for taking such good care of me and all the other patients at APC. Your warm spirits are a real tonic for all of us undergoing treatment. You're getting such great feedback, guys.
Everyone loves you too at the APC.
Bartley's one of the top ones as well. We love Bartley.
Yes, thank you very much,
Oh,
Bartley.
it's very mutual, Bartley.
Still here, still queer, rainbowing out the wrinkles.
And our two guests today seem to be really successful at that. We have Mick Cromer.
Yes.
And Molly, I don't know your last name.
Lowther.
Lowther?
Yes.
Great. You've had so much fan mail from your patients and customers. It's been quite amazing, hasn't it? We don't normally get that.
Yes.
So you're obviously
Especially
good.
the Coits champion.
You're obviously very good at what you do. One is a prostate nurse practitioner. And Molly, tell us again a little bit more about what you do in general as an exercise physiologist.
I see mostly cancer patients, but also see NDIS, musculoskeletal. So we work with exercise to rehabilitate patients who have injuries or conditions or need treatment.
Yeah.
And we work with them one-on-one or in large fun groups as well.
Now, you talked about safe exercise because you're dealing with chronic illness. What does that mean? If you go to a PT, they wouldn't know about that, of course. They might, but you're especially involved in that.
Yeah, exactly. So a PT, there's some excellent PTs out there.
There are.
And they may know a little bit about something, but we've studied it and researched it. So safe exercise is anything you can do safely without injury. And a lot of the exercises we do are to prevent injury, or things like if you've got low bone density, you want to prevent falls and fractures. So everything's about keeping the person as healthy as possible.
So if someone who had a woman with breast cancer went, how would you tailor their program?
It depends on what part of treatment they're at. So if they're having chemotherapy, it's very important to exercise before and after chemotherapy and during, if you can. So an exercise physiologist would be good at making sure it's modified to suit what the patient's going through. So if she's struggling with fatigue or a thing called peripheral neuropathy where you've got numbness in the hands and feet, you need to make sure that the exercises are tailored towards that. And if they're going for surgery, you want to get them as strong as possible before surgery so that they can recover well without losing too much muscle mass and function.
Gosh.
Fantastic.
So you have to push in some areas and back off in others. With the bone density issue, are there exercises you can do to help with bone density?
Absolutely. Impact loading, jumping. As much jumping as you can. You start with nice, gentle.
Yeah. Why has nobody ever said that to me?
I have jumping in my program.
You are seeing an exercise
Designed
physiologist, my friend. Sounds like we could all do is
just jumping. Best way to load the skeleton and keep your muscles and bones both strong.
Wow.
Are there any other exercises that help with those sort of things?
Absolutely. Pickleball.
Yes, baby!
The side effects of the drugs for men are that we get menopause.
Yes.
Which is no menopause anyway. I don't know why.
Yes, it finally means something.
So the exercises are probably similar between men who have prostate cancer and are on ADT therapy and women who are just getting older.
Yes, very true. Taking away the hormones and it just creates this flow-on effect of lowered bone density and muscle mass. So anyone of a certain age, and it's generally over 45 or 50, so it's not that old, should be doing some kind of impact loading and more than walking. Doctors love to say that walking is enough. It's not quite enough. We need to do a bit more than that if we can.
And what about balance? Because that's another thing that you've got a chronic illness, but just getting older anyway, that we say tends to go. How can you help us with our balance?
You practice. Stand on one leg, stand with feet in tandem stance, so one foot in front of the other. Close your eyes and see if you can stay balanced.
Got you.
Turn your head side to side, see if you can. So you've got to challenge yourself. And if you don't use it, you lose it. So you'll find that you haven't noticed, but then all of a sudden it's gone. So you do need to practice at it.
We have a little water tank in the gym there, and you put it in your hands like this, and you have to walk.
Well, this is radio, darling. So
to make you fall over, and it's very useful if the other people push them.
Yes, Peter's very good at pushing everyone who holds the water tank.
Other people to fall down. So this is part of the exercise, is it? The pushing?
The fun part.
No, I never push that hard.
Okay.
Just a little bit. A nudge.
Yes, so I find sometimes I'm on the dance floor, I'm thinking, I'm not as rocking it as I was, which generally is a balance thing. You know what I mean? I might not step out there quite as boldly, so I should just do it.
Practice, yes. And dancing is also very good for bones. It's impact.
Fantastic.
Impact.
A great one.
Because
what about
it's
mental
jumping.
health? Do you work on that as well? Cognitive health?
Absolutely. So even just by having groups exercise together can help mental health. It has that feeling of connection, makes it more fun, but exercise itself stimulates brain growth, lowers inflammation, and actually makes you feel good and keeps your memory going better than if you didn't exercise. So, yes, great for brain health.
I have to say, I'm going through a bit at the moment. This has made me feel a bit down in the dumps, a few things that I can't control about life. And I've thought that I've gone to the gym because I'm just thinking that is one thing I can control. And some of it is sort of weights, but some of it might just be getting on that bike for a bit of cardio. But it's more just to feel better, I think.
Yeah, the blood flowing, aerobic exercise is the best, and going for walks with friends, doing something you enjoy will just lift the mood immediately.
Wow. So,
what are the funnest exercises you've given people?
Oh, the ones I find the most fun are the ones that they find really challenging. So I don't know if that's appropriate for me. But no, a lot of the jumping, asking older males to try and skip, like you did as a girl in primary school. Very entertaining to watch.
Oh, I see. You're enjoying it because you're having a good old laugh.
Pretty much.
Yeah, skipping is challenging, isn't it? When you watch boxers, I think boxers have to be maybe the fittest sports people. They're just ridiculous. And the way they're skipping triple, quadruple, crossing and all of that coordination and puffing. I guess you're also trying to grow lung capacity as well because we lose that.
Work the lungs, work the heart, keep every system working functionally. So exercise works every part of the body all at once. There's no drug or pill that can match what exercise does.
Wow. That should be a bumper sticker, shouldn't it?
Yeah. And I can vouch for it too. Every time I leave the fitness session, I always feel on top of the world, even though at other times I might feel down about my condition or whatever. But every time I leave the fitness group, I feel like I've had fun with people, I've been doing something about it, and I come out the other end always feeling on high. So it's a fantastic thing to do with chronic illnesses, to try and do exercise training.
Why cancer? Did you have to do special because you said, Molly, that you specialise, most of the people that you train, if you like, have cancer of some sort. Yeah. Did you decide to specialise in that?
Yeah, I moved here and started treating people who had breast cancer, and it's very rewarding. As an exercise physiologist, our role is always rewarding, and I love that. And then through COVID, actually, I did my Masters of Exercise Oncology online because I'm not seeing as many people, so I thought I'd study. So then I got, the further degree to specialise in cancer.
Still here, still queer, breaking down the intergenerational barriers with laughter and insight.
Oh, that's us, and we've been doing it. A couple of guests from the APC, which for your information is...
the Australian Prostate Centre.
Said. We've got Mick, we've got Molly, and we've got people who are very appreciative of the information you're giving. Wow.
We have.
Thanks for the informative messages.
Galore.
Yeah, we have. Anyway, so wow, thanks for the informative messages on skipping and all that has been discussed. Guess who's buying a skipping rope tomorrow? That's Robbie from Mornington.
Fantastic.
Crucial.
Is it
crucial?
How do you do skipping? Every morning?
A couple of minutes. Start with 30 seconds, build up. It is harder than you think, but you can get very good at it very quickly.
Yes.
It is. Every time I do it, I trip over and fall on my face.
Yeah. So this is all from our exercise physiologist who's telling you that you've got to jump up and down for your bone density, aren't you?
Yeah.
Yes, correct. As
Thank
much
you.
as you can.
So, again, I didn't know this. Now, Pete, you reckon that Mick's been involved in something very LGBTQIA related.
Absolutely. It's about probing the prostate.
Yes.
Now, that's only part of the name. So I'll let you tell us about this study that you're setting up at the moment.
So this program was actually an idea of John at Thorn Harbour Health and Rachel, one of our colleagues at the APC, who came up with this idea that we should do a sort of outreach program to explain about doing PSA checks as you get older, particularly with the gay, bisexual and trans women community here in Melbourne. So it's a little pilot study. And basically we're going to do a series of education sessions and then do a couple of outreach clinics here at the Pride Centre, at Thorn Harbour Health and also at APC. So before we did that, we co-designed it with the community. We had a series of focus groups with those stakeholders and set it up basically. It's been a lot of fun.
And why fun? Tell us about it.
So we basically, at the beginning, we did the clinical stakeholders, so Thorn Harbour Health, APC. We got in a room together. Look, this is what we want to do. And we said, okay, let's co-design it. Let's get the community involved. So we did a focus group with gay and bisexual men from around Melbourne. And then we ran another focus group with a group of trans women. And it was just terribly good fun. We thought, we're going to have to be very carefully watch our P's and Q's. But
yes,
actually,
definitely.
it was terribly fun. And they were full of ideas. They were irreverent. We spent 10 minutes talking about Kylie Minogue's brother. It just got so off topic, but it was so much fun. Yeah, it was great.
And you found that people were wanting to be involved because they were concerned.
Yeah, it was a motherload of ideas. People were unsure of when they should be getting checked. Some people had experienced that. I think one or two people had prostate cancer and were like, look, when it happened to me, I had no idea what was going on. I didn't even know I needed to do a PSA check. And we were all driven a lot by this idea. I think during the AIDS crisis in the 80s and 90s, a lot of the people who should have been old enough now to share their experiences of prostate cancer aren't with us. So that there's that gap. It's the tagline of your show, it's intergenerational. That generation is rather depleted, and so we're trying to rebuild that and get people to understand about PSA checks and to talk to each other about it.
What does PSA stand for?
So that's your prostate specific antigen blood test. There's no digital rectal exam anymore. We just do a blood test, and that's not as common knowledge as you think. People asking us what does PSA stand for is a very common question. In fact, yeah.
It's good to know. And even though, of course, I don't have a prostate, as we've already discussed, it's a very common problem, isn't it?
But all people with prostates, of course, can come down with prostate cancer, and that includes trans women as well.
It does. And that focus group was fascinating. So trans women are all over it. They know all about their health. They know all about their blood parameters and the things that they need to get checked. And we thought, we've got to be really careful how we talk to this group. They've been through a lot. They get exposed to a lot of phobias and negative comment, but they were very open and they wanted to tell us all about it. We got heaps of information about how that group would like to be talked to about the PSA blood test. We're not children. Just tell us what we need to do and we'll do it. So that was really useful.
Yes, I know. I've come across men who don't even know what it is. I guess you come across that as well.
Yeah, absolutely. Yeah, people are often very unsure of what the prostate is, what that gland does, and how to do that check basically with the blood test.
What does it do?
So yeah, just for all our listeners, a little anatomy lesson. This will be great fun. So the prostate is this tiny little gland. Usually it's about the size of a walnut. It basically produces the secretions that sperm travel within, along with the semen, which comes from a slightly smaller gland behind the prostate, and moves it all into the urethra to expel it from the body. Basically, the prostate contracts and squeezes it all out of there. So it does have a noticeable role, but people, I think, just miss that spot in health in year 12.
Yeah, that's right.
We're not really concerned with it at that age.
Did you get any insights from the groups that you have held already?
Yeah, we did. We got heaps from them. They were only three in total, an hour long. But the 2 sessions with the community groups were absolutely fabulous. They told us about a lack of information, barriers to accessing PSA testing, and just a complete lack of informational need. So we're like, look, what about if we did an outreach clinic where we came down to Thorn Harbour or we came down to the Pride Centre and we just ran a clinic there where you guys are? And they're like, that makes life so much easier. So that's what we're going to do.
Wow.
Fantastic. And
do you know what days you're going to be there, or we haven't sorted that out?
They've not been set yet, but we'll put them out on the socials in June.
Yeah, terrific.
Okay.
I'm finding out that I've learnt so much, but what I really like is that you two are so eloquent and friendly and warm and knowledgeable, and the feedback that we're getting. How wonderful is that at this stage in your life when you're facing something that you may not have even really realised you would, or is really difficult to go through. Pete, you say you've had prostate cancer for how long?
6 years this year.
Yeah. That you can go and have these people right in front of us as resources and come away. You're talking about coming away from your exercise like elated.
Exactly. That's because Molly's there, of course.
Thanks, Pete.
Joking around with everyone.
They are related. It's a rowdy group. We hear them all laughing and backslapping in there. It's a great vibe.
And it's an interesting group because when new people come in, and they do come in regularly, and they enter the group, this is my impression anyway, they enter the group feeling awful about, oh, I've got prostate cancer, what do I do about it? And then people ask them, what's the journey they're on so far, and how long have they had it? And sometimes it's 6 months, and they're thinking, am I going to pass away now? Or what's happening? So there's all those discussions that go on, and most people live for quite a long time after it. So it's not a death sentence right at the moment.
We've already got a lovely message from somebody who's elated. Great program. Thanks, including silver-tongued Mick and warm-hearted Molly. I'm elated, they say. Because I think, what I'm really getting for you is people going through a really hard time doesn't mean we've got to all be morose about it. It's bad enough.
Exactly.
So walking in and seeing your lovely faces and feeling your warmth, that there's a lot of comfort in that, isn't there, before you even get treatment, or as well as your medical treatment. There should be more of it. That's what I'm thinking.
And what would you both say to someone who was hesitant in getting tested?
I think beyond being tested is just knowing that there's enormous resources out there to get the information that you need to understand what's happening. So there really is nothing to be frightened of. There's so many resources that you can lean into, figure out what's going on, and feel like you have control.
Absolutely. Couldn't agree more to that.
That is totally great news. It's been wonderful having you. If people want to know more, they go to the APC website?
Yeah, or just come down and see us in Blackwood Street, North Melbourne.
Correct.
And the groups that you're setting up, how do they find out more about them?
So that information will be posted on Thorn Harbour's website, I believe, and also the Australian Prostate Centre's website.
Terrific. Who wouldn't want that? Thanks again, guys.
Thank you so much, guys.
Don't miss The Devil Wears Prada 2 in cinemas.
Miranda, hi.
Pull yourself together. We have work to do. And by we, I mean you.
Meryl Streep, Anne Hathaway, Emily Blunt, and Stanley Tucci are back.
Oh-de-da.
On April 30.
Look what TJ Maxx dragged him.
I am the new features editor at Runway.
No, you are not.
Icons reign forever.
Cheers.
Wait. I hope to God that's not what you're wearing to the dinner. That's all.
Get tickets now. The Devil Wears Prada 2. Only in cinemas April 30. Directed by David Frankel.
This podcast is brought to you by Australia's LGBTQIA+ community media organisation, Joy.